We can use laser beams that target water in the skin and use that beam to sculpt down and blend in the scars.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
I'm doing pretty well, Hadar. I've just been thinking more and more about lasers. What about you?
Ooh. Oh, are we going to space, man? Is that what we're going to do? Please, can we jump on the next shuttle? Or are you referring to more therapeutic applications?
I'm referring to more therapeutic applications, but you can sit on the laser beam if you want.
Oh, man. I'm not a huge Star Wars fan, but definitely always like that mystery about lasers, right? It has the cool factor, but in dermatology, we took it to the next level, no question about it. And a lot of patients come to me and ask me, hey, can laser help for this? Can laser help for that? And there's a lot of knowledge, and the new devices keep coming up, new technologies, new applications, really exciting field. And dermatology, I must add, is in the forefront of that. So when it comes to new treatment, I think we want to talk to an expert because, boy, there's a lot to cover.
There sure is a lot to cover, but thankfully you and I don't have to do it. We have Dr. Azadeh Shirazi, who is a board-certified dermatologist. She's at her practice in La Jolla at the La Jolla Dermatology and Laser Surgery Center. She's got a lot of experience with lasers because she also completed a research fellowship at the Harvard Medical School at the Wellman Center of Photomedicine. And we know that that is one of the premier institutes to learn about, laser technologies and light technology. So Azadeh, we are super excited to have you on the podcast and talk lasers with you.
Thank you so much for having me. I'm excited because I love lasers.
And if we get through talking with these lasers, I think at the end of it, we'll all get $1 million. Sorry, I had to throw in an Austin Powers reference. But anyway, I did my piece.
No, thank you very much for that, Raja. But I actually want to start right there with your love for lasers because dermatology has such a variable application of therapeutics and diagnostics. And, you can sit in the office all day and just write prescriptions, which is awesome. But you can use your hands and even go to the OR and do all kinds of procedures. But you like lasers. Tell us why.
Well, in dermatology, we have a lot of toys, a lot of lasers and devices, and these devices target different things in the skin. So they're tools that dermatologists utilize in their practice to treat different skin conditions, whether that's acne scars or broken capillaries and brown spots, sun damage. So really depending on the type of skin concern that we see, we can use different wavelengths of light and tune to different depths and densities to target some of these specific skin concerns. And so I find it really fascinating for me because I'm able to remove something very specific in the skin without really causing any damage or burns to the rest of the skin.
Right. And that we cannot really go ahead without mentioning the fact that you were at the Wellman Center. So we cannot pass Rox Anderson and his discoveries in this that really many dermatologists may not know or forget, but it was a dermatologist, Dr. Anderson, who came up with concepts that allow us now to use laser therapeutically, right?
That's right. And that's called selective photothermolysis. And he was able to prove that by selecting different targets, we're able to remove whatever we want from the skin without damaging the rest of the tissues. So it has a lot of different applications. In my practice, because we're out in California, we see a lot of sun damage. So broken capillaries, brown spots that gives the skin a weathered appearance. And so we use different devices like the V-beam laser, which targets hemoglobin, to remove some of these red blotches, as well as melanin, the pigment color. These devices can target that and selectively bring it to the surface of the skin, and then it just flakes off, and the skin is left looking, more even toned and healthier, and, without a lot of the weathering that we get from the sun.
And I think most patients that come to my clinic are well aware of laser hair removal, or more recently, people are
Mm-hmm.
calling it laser hair reduction.
Mm-hmm.
But when we talk about scar treatments, they're usually not aware of this. And I think every clinician, any board certified dermatologist probably uses a lot of isotretinoin. We treat patients who have very severe acne. But then you get the pleasure of really ending the therapy and seeing the results, but then they are left behind with scars. Now, when I go over the different therapeutics, I go over many things, but I think one of the most effective treatments that we have are lasers. So, can you tell us maybe which lasers, what's the principle behind treating acne scars, and which lasers you use in your practice?
Yeah, so acne scars is something that I love treating because these patients come to you with their confidence being affected by these scars they've been carrying around for a long time. And so being able to smooth them out, or at least help blend them in, can really impact all aspects of their life. And that's really rewarding to me. I always tell patients we can never remove scars completely, but we can certainly improve them. And with acne scars, they do require maintenance over a lifetime because as we age, our skin structures change, we lose collagen, and so we do have to make sure that we do some maintenance over time to keep the results and the scars looking good. But one of my favorite treatments is laser resurfacing, and that's using lasers like the CO2 laser or the erbium laser to really sculpt the skin and the acne scars. They come in different shapes and sizes with scars. Some of them are what are called rolling scars. Some of them are atrophic scars, and they're depressed into the skin, and they have these very sharp borders. So we can use laser beams that target water in the skin, and use that beam to sculpt down and blend in the scars. Now, these lasers are ablative, which means that they actually affect the surface of the skin. There are also non-ablative lasers, and your audience may know them as Fraxel or the halo laser. So they're non-ablative resurfacing lasers that don't really affect the surface of the skin, but they penetrate deep beneath the surface and help remodel scars to make them blend in a lot better. And so I tend to usually start off with a very small spot size with the laser and just go around and treat the edges of the acne scars, because that's sometimes what your eye really catches, is the distinct, demarcation of the scars. So using a very small spot size with a CO2 laser or an erbium laser, I like to blur the edge a little bit, and then use either non-ablative resurfacing or fractionated ablative resurfacing to go deep into the skin and help regenerate new skin, new collagen that allows for the scars to remodel. And so that's usually my strategy now. I always tell people it will take usually more than one session. On average, patients do about 3 to 5 sessions to really start to see improvement.
Azadeh, can you talk a little bit about acne scars in particular? Because I think that's such an interesting area. Not all acne scars are created equal. Can you break down what are the different kind of acne scars there are, and how does that go into your thinking of how am I going to make this better?
Yeah, I mean, lasers is one aspect, the treatment plan, but I also like to combine it with other things like fillers or biostimulatory agents like Sculptra, as well as subcision, because as acne scars are tethered down by these fibers, and sometimes they need to be released with a procedure called subcision, which uses a special needle that goes underneath these scars and releases the tethering that's pulling them down. And I find when I first do the subcision before doing the laser treatment, I get better results. It's almost like the scars are released and are able to be remodeled
Right.
better with lasers. And you asked a very good question in terms of the types of acne scars. And there are, atrophic scars, which are depressed scars that can be really thin and they can be very wide. There are ice pick scars, which are the opposite. They tend to be really narrow and very deep into the skin. Now, they tend to be the hardest to treat with lasers. I find other modalities like using a chemical peel to selectively, target those sometimes works better than lasers just because of the nature of that type of scar being very narrow. They don't respond to lasers as well as the other types. And then there are, rolling scars, which if you can imagine, they tend to be a little bit more narrow than the atrophic scars. And they tend to respond really well to lasers. And, the superficial type of scars tend to do the best and tend to respond the fastest in terms of lasers when we are talking about acne scars. Sometimes I'll do a combination of fractionated lasers after doing a full field laser for that type of scars. And then we've got, the boxcar scars, which tend to be very boxy, as the name would give it away, almost like you see those cartoons with the cars that have that square sort of appearance to them. They tend to have very sharp edges to them, as opposed to the rolling scars that tend to be more rounded at the bottom. And those do really well with the sculpting method I was mentioning earlier to help make them less visible or less delineated in the skin. So those are, the different types of scars that can be treated quite effectively with resurfacing lasers.
Thanks for taking us through the different acne scars and just how you approach it. Now, if you don't mind just discussing a little bit more, you said the ice pick scars, which are always the big bugaboo, they're deeper than wider and they're definitely narrow. How do you get to the base? Are you doing something like a peel right into the base of that scar to try to then convert them into something that's more shallow? Is that the thought process there?
Yeah, so that's a great question. I tend to favor either TCA, like 100% TCA solution, or even a phenol solution. And I use a little toothpick, which is very sharp, and just place the solution in the middle of that ice pick scar with the idea of it allowing the scar to close, because what makes those scars very visible is the opening, right? It's got the very opening in the skin and then it goes very narrow and very deep. And so by doing the TCA solution in those scars over multiple sessions, you're getting your skin to stimulate collagen production to fill in that scar so that it's smooth, as opposed to, it looking like a little hole in the skin, if you will. This technique also works for like large pores that sometimes people develop, just because you're putting it in the middle of that scar to get the skin to stimulate and form new collagen to fill in the scar, if you will.
That's pretty incredible. I think all our listeners kind of listening now realizing that dermatologists are really, really good at this because you can combine medical, surgical, different modalities to really allow really great treatment and great outcomes. I wanted to touch about a certain group of population among our patients, those who have darker skin type. And
Mm-hmm.
there are concerns there because a lot of their scars tend to be darker, which is one consideration. So it's not just the texture issue, there's also the pigment issue. And then the laser selection can also be complex, right? Because some light types in the laser may cause more damage than benefit. So how do you think about that? And what do you suggest to people who have darker skin type?
Yeah, you're absolutely right. Darker skin types are going to be able to produce more melanin as a response to lasers. So it does put them at a higher risk of having hyperpigmentation, post-inflammatory hyperpigmentation after laser treatments. You also have to be cautious in darker skin because their fibroblasts are more robust. So they tend to produce more collagen, which means that you could also end up with thicker scars, something called hypertrophic scars that we see sometimes with acne, but also with laser treatment. So for those two reasons, melanin production and hyperpigmentation, as well as the fibroblast production of excess collagen, you really have to be really cautious with darker skin. I always treat very conservatively with lower energy levels, smaller spot sizes and less density when I am, calculating the settings for treating darker skin. And I also start them on a regimen in preparation for hyperpigmentation because especially with the ablative lasers, it's a very high chance that after the laser treatments, they may be left with some pigmentation. Now, it's temporary, the post-inflammatory hyperpigmentation, but nevertheless, it can stick around for many months. So the skincare after the laser treatment becomes an important part of the treatment plan. And, when I look at lasers, I think of the cold laser and then the hot laser. That means lasers that have the ability to generate a lot of heat versus ones that don't generate as much heat. So the CO2 laser classically is a great laser for acne scars, but unfortunately it tends to generate a lot of heat. So sometimes that's not the safest laser that we have available for us to treat darker skin. So I much rather use an erbium laser, which is, I call that the cold laser. And when you use it in a fractionated pattern where you're not treating the entire surface of the skin, so you're just treating the skin surface in fractions, that tends to be a much better option for somebody with darker skin as opposed to a fully ablative where you're treating the entire surface of the skin. That's going to be a lot more aggressive, and certainly, avoiding the CO2 is helpful in those patients.
Yeah, Azadeh, I was just gonna say, when it comes to treating darker skin types, I mean, one of the things that we've done quite frequently is just going to non-radio frequency microneedling. That seems to actually work pretty well, and then also going to radio frequency microneedling. I know you're going to touch on it, so I appreciate that. And yes, please do expand beyond lasers. Let's not stick to just lasers since we're talking about acne scars.
Sure, sure. Yeah. So the RF microneedling is going to be, safe. And I always tell people it's not going to be as powerful and not going to be as robust. But certainly for somebody with darker skin, you want to go slow, but do multiple sessions. So you're looking at a good 5-session series with RF microneedling. The radio frequency portion uses heat to help remodel the scar. And then the needling portion is just tiny little needles that goes in and out of the skin, and that has a more of a mechanical portion to it where you're not using light energy, which has the risk of hyperpigmentation, but rather you're using mechanical energy to disrupt the skin and allow the skin to remodel and allow those acne scars to smooth out, and so that helps with texture. So that's a great option for somebody with darker skin, and you can avoid some of the risks. Now, we talked about permanent scars, but I don't know if you guys notice this in your practice, but I see a lot of people that come in and they have like redness, the red stains that are left after a pimple goes
Yes.
away, or a brown spot that after a pimple goes away. And they're in the office and they think that they're scars, that they're going to be there forever. But, those are more stains and discoloration in the skin. And a lot of times they fade without leaving a permanent mark. And so that is called post-inflammatory erythema or post-inflammatory hyperpigmentation, which are the red and brown spots that are left over after acne. And so we treat those differently than we would, the established scars in the skin. So I always like to make that distinction that those are stains rather than true scars. And, they do tend to fade, but lasers certainly could help fade them faster.
Yeah, sometimes patients will come and say, "Oh, you got my acne better, but this led to dark spots or red spots." And, I have to explain to them this is actually the natural course of the condition. And, on that note, do you ever treat with or give any topicals to help reduce the redness?
Yeah, so retinoids work really well for both post-inflammatory hyperpigmentation and erythema because they allow your skin to renew more effectively. Your cell turnover is going to be much better, and so I find that can help if you're looking for something to do at home. Retinoids are great at fading some of the stains that are left over after acne. in addition to, preventing acne at the very first sign of formation, because one way to get rid of your red and brown spots is to prevent the acne that
Yeah,
is causing
exactly.
them. So prevention, it's always so important. But yeah, retinoids, and then certainly azelaic acid is another favorite of mine that does help with both exfoliation and some of the pigmentation that's left behind after acne is healed. Do you have any favorites yourself?
Oh, I appreciate you asking the question. We published in the JAD on different modalities to reduce hyperpigmentation. And a couple other, I think, fan favorites. One is niacinamide works okay. I think it depends on the concentration, but there's also licorice extract. And I think a lot of people are using now topical tranexamic acid as another approach. And we're about to run a study on a variant of topical tranexamic acid. We're going to be doing that on acne hyperpigmentation. But I'm curious, do you use tranexamic acid? Do you use that orally or do you use it topically? I know that's been a big source of questions for a lot of patients and even a lot of other colleagues.
Yeah, I think topically, I don't think it works very well, probably because it just doesn't penetrate, but I love combining it with either laser resurfacing or microneedling. We use that a lot
That's a
for
great point.
patients with melasma or hyperpigmentation. And I think, after lasers or microneedling, there's channels that are open. And so I think it gives it an opportunity to really be able to penetrate and work more effectively than if you were just using it, in your skincare routine. In terms of post-inflammatory hyperpigmentation, I don't find it to be as helpful orally as it is for melasma. Something about, melasma, it works so much better for melasma than just your typical post-inflammatory hyperpigmentation. What are your thoughts on it?
Yeah, I agree that if anything, oral formulation is probably better. Although I got to say, in my hands, wasn't as successful as I expected, but I'm still learning. So I think I will get some tips from you on how to do this better when we get offline. I wanted to make sure that we cover another topic because this is really something cool and new. And we talked a lot about pigment and how to maybe avoid hyperpigmentation, but some people already come with increased pigment in their skin called a tattoo. And the years go by, and maybe there's a loved one that's not so loved anymore. And now it's time to get rid of that tattoo. And, we always talk about it in the context of laser, but I think you wanted to introduce us to a new technique that allows us to remove the pigment from the skin in a slightly different manner, right?
Yes, and I'm so excited about this because, the first 10, 12 years of my career, because I've been in practice now for over 15 years, but the first 10, 12 years I worked with Vic Ross, who trained under Rox Anderson, and we had all these lasers, the Q switch lasers that we use for tattoo removal. And I just found tattoo removal to be so challenging. People would come in and it doesn't work for all the colors. Particularly the reds, the greens, the purples were extremely hard to target with a tattoo laser. And so recently I've been involved with a company in coming up with a non-laser way of removing tattoos. One, because lasers are so limited, sometimes it would take 15, 20 sessions to really help lighten a tattoo, but also because recent reports have shown that a lot of the tattoo inks have health concerns. I know the EU has recently banned 4,200 inks due to potential carcinogenic risks and other health hazards. And if you think about it, lasers simply target these tattoo pigments, they break them up, and then it's up to your body to really scavenge and take up the ink, and eventually it gets circulated throughout your body and gets through the lymphatic system where you have to, pee, poop, or sweat it out. Really, we're not even really sure. But there's no direct, expel of the ink from your skin. It simply gets taken up into your immune system. So a new method called TERP, which is transepidermal pigment release. This allows for your skin to directly expel the tattoo ink from the skin, which a lot of patients find more attractive just because they don't have to worry about that tattoo ink circulating throughout their lymphatics, but also we're able to clear tattoos in much fewer sessions, usually 3 to 5 sessions to treat a tattoo that would otherwise take maybe 15 plus with a laser. And this technology also doesn't depend on the color of tattoos, because it doesn't matter what color of ink is in the skin, because it is a mechanical ablation of tattoo removal. It really doesn't use any lasers or light. And so that's another, a positive attribute to this removal technique. And so I find it to be, definitely much more cost effective, because these laser machines also, as a private practice person, these devices can cost $200,000, $300,000. And this is a much more simple, direct approach to tattoo removal that I find my patients are doing really well with. And so it uses mechanical ablation, essentially, meaning that we form these what we call tegulas, little areas of treatment sites that are separated, almost like you would see in a fractionated laser. But it uses a mechanical device that breaks up the surface of the skin, and then it allows your inflammatory cells to really help extract that ink from the skin.
So this is really good to know. So when you show up at the doctor's office and they say they're going to give you a TERP, hopefully you're there for the transepidermal pigment release, and they're not
Yeah, not
setting
the
you up for
other.
a
It's
transurethral
actually
resection of the prostate.
That's a good analogy. No, actually, TERP, it's TERP as opposed to TU, but I see how that could
One vowel makes such a difference, my friend.
That's right. That's right. Yeah. So
Absolutely.
another thing is it's actually not painful like it is. Like when I was doing laser tattoo removal, I would have to inject local lidocaine into the skin to make the patient comfortable. With this, I just use topical 5% lidocaine for 30 minutes, and patients are comfortable. Now, as a dermatologist, I have to say, when we first started this method, we're always taught to keep the area moist, right? Keep the area moist, the skin heals faster. And when we tried that with this technology, it didn't work. It trapped the ink in the skin. And the reason for that is because the epidermal cells would migrate too fast and close too quickly, and they would trap the ink underneath the skin. So the post care for this has become really important for us to finesse, and that's we have to keep this area dry actually without applying any ointments, because it does use your body's natural healing powers to extract that ink from the skin. So in order to allow the expel of the ink, we, against our usual wound care techniques, we try to dry it out in a sense to allow little scabs to form in that fractionated pattern that then expel the ink. And we actually did histology on the scabs or the eschars that were released, and they all had the tattoo ink in it. And then, it heals in about 7 to 10 days with a little area of redness. And after, several weeks, it becomes almost skin color and very smooth, and you don't see any ink in there at all. So I think it's really going to be a game changer for tattoo removal and just the whole
Yeah.
tattoo removal industry, because we're not doing a great job with lasers, let's say.
No, very cool. And, you said dry wound healing. To me, it's like screeching on glass. It's really hard for me to hear that as a wound healing guy, but I totally get it. And that's why I love about what we do, because, right, you always learn one way, but then you understand what you're doing, you understand the mechanism, you understand what you're trying to achieve, and you come up with a different regimen, and voila, you got success. So, Dr. Shirazi, thank you so much. I feel like we could have spent, I don't know, 3 hours talking about this stuff, but
Well,
uh,
if I just published a paper in the JDD on this non-laser tattoo removal. So if you want to learn more, check it out. It's in the November issue of the Drugs in Dermatology journal, and it's the fractionated mechanical ablation for tattoo removal.
Or you
I
can
think
just
what
check out Dr. Shirazi's practice. Go see her.
Yeah.
She'll just suck that pigment right out of your tattoo. Thank you so much for joining us. Thank you for your expertise. And I hope to learn from you in future episodes.
I think what you're
Yeah,
trying to
thank
say
you so
is
much for
that
having me.
I think what Hadar's trying to say is that we could have gone much below the surface and drilled in deeper, but this was good.
Of
We covered a
course.
lot, though. I had a great time. I'm very passionate about, dermatology, as you guys are. So it was a good
Very
discussion.
No, we loved it.
excellent. Thank you
Yeah,
so
thank
much.
you. Hey, listeners, we want to share some great news with you. Over the last year, we have been reviewing and redesigning the successful Integrative Skin Health series. Newly named Dermatology, Clinical and Integrative Essentials, or DCIE, a team of incredible integrative dermatology experts have been working on a new and improved curriculum focused on common patient questions and concerns. We're excited to launch the new DCIE program on January 1st, 2024. And right now, through November 30th, you can save $200 off the regular price when you sign up during our pre-sale. But that's not all. You also get immediate access to the original program, the Integrative Skin Health series. So it's like getting two programs in one.
You know, what's really great about this program is that it's geared towards PAs, NPs, MDs, and other healthcare professionals who are new to the profession or seasoned veterans because, evidence-based integrative approaches are still emerging for all of us.